So hello students, in this video we'll be learning about antipsychotic drugs. So basically, before we jump into it, what is the difference between a psychosis and a neurosis? Psychosis, you can see the man here, there'll be a distortion between what he thinks and what he does, and the capacity to recognize what is real, what is hallucination will be lost. So he'll be behaving very violent, and hallucinations and delusions will be present in such case. Whereas neurosis, we can see this in common every alternate individual, one or the other features will be there. Few people will be facing anxiety, there'll be phobias, OCDs react to depression, like depression reacting to the loss of either loved ones or either the loss of financial things, and we have post-traumatic stress disorder and hysteria. These all comes under neurosis, where the connection with the reality is still present. Hallucinations and delusions are not there, they're absent. So there will not be a distortion between the thought and what he is doing. So then we're going to antipsychotic drugs. Here there are many names: Chlorpromazine, Chlorpromazine, Thiridazone, Fluphenazine, Trifluphenazine. I expect that these are a bit of tongue twisters and they're difficult to remember, so I just made a mnemonic out of it. So first thing is Chlorpromazine. Imagine this chlor to be chor. Chor is thief in Hindi. So this chor is very pro, and he'll be doing massive robberies, and he had escaped from police 3 times. So we have Chlorpromazine, which is the first drug, and we have Triflu, which means 3 times he had escaped from the police. Triflu, he flew away from the police 3 times. Triflupromazine, and we have Fluphenazine, and we have Trifluperazine. So he had escaped 3 times, and ultimately he was caught by the police, and he had kept in a secret hall he was kept in. So Haloperidol, and he was offered a pen to sign that to accept all his robberies. Penfluridol, and we have Flupentixol. He just threw the pen, he just slapped the police, and he just ran away for the 4th time also. So this is how you can remember few of the names with this cartoon. You can take a screenshot of it. Later, there came atypical antipsychotics. We'll try to understand everything in the next upcoming slides. So the police, upon getting hit by the robber on his teeth, he came in an Ola cab, Olanzapine. He came in an Ola cab, and the doctor had explained that the tooth were broken and it is a little bit of risky procedure, so Risperidone, but he told, it's okay, I'll apply some close-up paste on your tooth, Clozapine, and there'll be chote pain, like little bit of pain will be there, it's okay, I mean you can manage it. So it is Zotapine. It is one of the drug of atypical antipsychotics. Remember, chote pain is Zotapine. You can go back and see the table which has all the drugs. So he'll be shouting out of pain, which is aripiprazole. In Telugu we call it as shouting. RP is shouting, so don't shout, the doctor is telling. And he just asked him to zip his mouth and sit quiet. Ziprasidone, zip his mouth and sit quiet yappen. So these drugs are an examples. We can see the mnemonics here also. You can just take a screenshot so you can remember them easily with this story. So what happens in a psychosis patient? Hope you understood. So what happened is there will be an overactivity of dopamine in the limbic system. Limbic system is the part of the brain which controls our emotions, feelings, behavior and all. So just by blocking the activity of the D2 receptors, which means dopamine receptors of the limbic system, you will be understanding why I'm stressing on this limbic system in later phase. So in this limbic system, if we suppress the D2 receptors, the psychosis can be controlled. So this is how a normal network of dopaminergic system works. It goes into the prefrontal area, it goes into the temporal area. If there is an overriding or excessive release of dopamine, these red colored dots are excessive dopamine happening in that limbic system, which is causing psychosis. And how can we prove that? That this is a mechanism? So few drugs which will increase dopamine activity in the brain, like levodopa, amphetamine, bromocriptine, had found to increase psychosis. Based on this part, for increasing psychosis, so we confirmed that the causative mechanism behind this is increased dopamine, and we have to block the dopamine D2 receptors for treatment. Also PET scan, positron emission tomography, also confirmed the amount of receptors, dopamine receptors are more in psychotic patients. So this is the brain which is of the psychotic patient. If we suppress the limbic system, which will control the thought and behavior, by suppressing the D2 receptors, we'll be able to treat psychosis. But if we give any drug which will block dopamine receptors, it will also act on other body parts, other organs also. In that, one of the part is basal ganglia. Basal ganglia, if we block D2 receptors over here, the drug which I am giving will block everything. It won't have any particularity. It will block everything. So D2 receptors, if they are blocked in the basal ganglia, it leads to loss of the bodily movements. The speed will be lost. Hypokinesia will come. If it blocks, if the D2 receptors are blocked in the pituitary area, there will be increased amounts of prolactin which will be released. Prolactin, if it released, it causes galactorrhea and gynecomastia and all. Prolactin levels will be raised because D2, the dopamine, is blocked in the pituitary area. So these are the major adverse effects which we will be seeing in the people who will be taking these drugs, antipsychotics. If it works till here, it is okay, it is good. If it works till here, it is harmful. It works till it is harmful. How does the side effects occur? This is because of the increased dosing. If we keep on increasing the dose, these adverse effects will be occurring. If the dose is uniform, it might occur based on the duration also. If it is given for longer duration, these side effects might occur. Also, there is one more theory. Previously we thought dopamine, now we have also serotonin. Increased serotonin levels are also found to be causing psychosis. So what will antipsychotic drugs do? This is a normal mood of a human being. On giving antipsychotic drugs for a normal human who is already normal, there will be paucity of the thought, which means the thoughts will be lagging behind. Psychomotor will be slowed, emotional quietening will be there. Means the person who is normal will behave in a lower mood level. Whereas in the person who is already aggressive, he'll be brought back to normal. This is the mechanism of action, and this is the ultimate goal of bringing down an aggressive person to a normal phase, with psychosis to a normal phase. This is the treatment part. So antipsychotic drugs on an aggressive human, they'll bring them down to normal. Normal person, they'll bring them down to very low mood person. Also, they have alpha adrenergic blocking action, so that whenever alpha 1 receptors are blocked, it causes postural hypotension. That is one of the adverse effects which is common for antipsychotic drugs. Local anesthetic property, only chlorpromazine shows it, but we are not using because of irritant nature. And these are the overall adverse effects. It will make people gain weight, and there will be aggravation of seizures. Postural hypertension because of alpha 1 receptor blockade property, and hyperprolactinemia we saw because of pituitary dopamine inhibition. Then we have extrapyramidal side effects. These are the ones which are occurring due to the blockade of dopamine in basal ganglia. We have seen above that it is blocking all the limbic system, basal ganglia, pituitary. So because of blocking this part, all of these extrapyramidal side effects will occur. We know about Parkinsonism, that causes rigidity. Just clench your fist and see what happens on your forearm. It will cause rigidity, so you can't be moving your hand freely. There will be hypokinesia, there will be tremors, mask-like face, shuffling gait. So how to deal with it? Reduce the dose of antipsychotic drug. All these extrapyramidal side effects are dose dependent. So if you give more dose, these adverse effects will come because it will be antagonizing limbic system, more dose, antagonizing basal ganglia, more dose, antagonizing pituitary gland also. So just reduce the dose, come back to normal, reduce the dose, so that the side effects will also disappear gradually. That is the first step of treating extrapyramidal side effects. Second is add one anticholinergic drug which acts centrally. How does it work? Usually now dopamine antagonist drugs we are giving as treatment for psychotic patients. So when dopamine boxes are reducing here, the cholinergic system is still more and it is weighing more. So cholinergic system is weighing more. So if we give anticholinergic drug now, then the system will be balanced and there will be adverse effects will be subsided. So removing the boxes of cholinergic system, which means anticholinergic drug, if we can give, it will balance with the amount of dopamine left, so that the system will be balanced and there will be no all these adverse effects. So acute muscular dystonia is one of the adverse effects which will be seen with the excessive dosage of antipsychotics. There will be bizarre muscle spasms, torticollis, which is different neck on one side, locked jaw, tongue thrusting, grimacing of face, everything will be seen. Same thing, reduce the dose which you are giving, or add one anticholinergic drug so that it will balance, or change the drug to atypical antipsychotic. We will see what are the atypical antipsychotics later. Akathisia, you will see some restlessness and agitation also as one of the side effects. Treatment is benzodiazepine. Here the treatment will be benzodiazepine or add one anticholinergic drug, that is also a part of treatment. And we have malignant neuroleptic syndrome where there will be rigidity. See, all the muscles in his body are rigid, he can't move, it is immobile, there are lots of tremors, and he is facing hyperthermia also. Treat him as malignant hyperthermia patient. If you remember, it will be IV dantrolene. It will prevent the release of excessive calcium from the sarcoplasmic reticulum, or just replace the dopamine. The drugs which you gave, antipsychotics, blocked the D2, reduced the dopamine. So just replace the dopamine. Agree or mistake, and replace the dopamine by giving bromocriptine. Tardive dyskinesias, these are some few features of tardive dyskinesias, where pouting, puffing of cheeks, lip licking, constant chewing will be there. And they discovered a drug recently for tardive dyskinesia, which is a vesicular monoamine transporter. Its name is 2,4 deuterabenazine, which is how I remember, deuterabenazine and valbenazine. So remember like that. And we came to the atypical antipsychotics now. Here the drug names were already given, the Clozapine, Risk, Olacar, Clozapine. So how do they overcome the symptoms of extrapyramidal symptoms, which means basal ganglion are not affected? By not antagonizing D2 mostly. They have weak D2 blocking action, but previously we have seen that serotonin is also one of the reason for psychosis. So instead of blocking dopamine and causing all these extrapyramidal side effects, if we block serotonin, that would also help us in treating psychosis. So this is what these drugs will do. They'll block 5-HT2 receptors. Instead of dopamine receptors, so that the extrapyramidal symptoms won't be there. So this is the reason why for all the extrapyramidal side effects which we were learning, one of the treatment part is shift to an atypical antipsychotic drug. Because if you shift to atypical antipsychotic drug, there will be less dopaminergic antagonism and there will be more of serotonergic antagonism. Serotonergic antagonism will not cause all these extrapyramidal side effects. They all work in the same way. Also, few drugs will have partial agonist to 5-HT1A, so it will be helpful for depression also. If you see my depression and antidepressant drugs video, you'll be able to understand how does this 5-HT1A work. So this is how simple antipsychotic drugs are. And ziprasidone is zipping his mouth. Ziprasidone, it also has weak D2 action, but it blocks serotonin. So both dopamine and serotonin are the culprits. So instead of blocking dopamine, we are highly blocking serotonin, is what atypical antipsychotics are doing. Thank you for watching my video. Hope you had see you all in the next video. Please don't forget to subscribe to the channel. Thank you.